Thanks so much, Preeti. And on behalf of the National Center on Afterschool and Summer Enrichment, it is my pleasure to welcome you to this webinar on supporting and promoting mental health and out-of-school time. We appreciate you joining us today. And as Preeti said, it's wonderful to see people joining from all across the country. Our presenters for today include my colleagues, Katari Coleman and Suzanne Birdsall-Stone, and we're excited to welcome three guest presenters. Ebony Grace, the Chief Operating Officer for NJSAC, which is the New Jersey Statewide After-School Network and the NAA affiliate. Gina Warner, President and CEO of the National After-School Association, and Hillary Burkholder, Deputy Chief of Strategic Engagement with the Oklahoma Department of Human Services. Our agenda for today will include providing some context on our recently published brief on this topic, sharing some information and research about mental health needs of children, their families, and the out-of-school time workforce, sharing some strategies to address mental health needs. We'll have state and national after-school association examples woven throughout the presentation, and also an opportunity to hear from you about your strategies. And then we will wrap up and ask for your feedback. But now we'd like to know who's here today. So we'll have two quick polls for you. One is, what is your role? And Preeti is going to launch that one. And then we'll ask you something about how you support mental health and out-of-school time. So if folks could just take a minute to identify what your role is. Looks great, lot of responses coming in. Preeti, why don't we give this just a couple more seconds and then we can show the results.
Okay. You have just about everyone responding. We're at 67%.
Okay, so we've got a wide range of folks here, which is great. We have quite a lot of folks from school age networks, NAA affiliates. We have child care resource and referral folks. We have state education agency staff and 21st Century Community Learning Center, state CCDF lead agency staff. We also are pleased to see a number of providers joining us today, and some of our sister and brother technical assistance providers from the Office of Child Care and the Office of Head Start. Okay, now we're going to ask you about how you support mental health and out-of-school time. And you can select, I believe, as many as you want. Is that correct, Preeti?
Yes.
Okay, so let's give folks a couple minutes to do this one. Wow, it's really exciting to see the range and amount of strategies and roles that people take in supporting mental health and out-of-school time. Okay, I'm going to wrap this one up. Okay, so we have the most popular one is strengthen my own self-care skills, which is fantastic. We'll be focusing on that quite a bit in today's session. We also have a number of people identifying strategies and resources for reducing stress, increasing mindfulness, and using health interventions. as well as coordinating with community and state partners, building mental health and social and emotional learning into professional development, incorporating positive youth development and SEL programs into practices into programming, and then we also have a number of folks developing and implementing policies. So that's great. Thank you so much. And now I'm going to pass this over to Katari Coleman, and she's going to share our new brief. Katari? Katari, are you able to unmute yourself?
I'm able to unmute myself now, but I cannot start my video.
Okay, well, why don't you go ahead and start talking, and we'll see if
I
you
will.
can unmute the video.
No problem. Good afternoon, everyone. So excited to be here to share this information. We, NCASE, developed this recently released practice brief supporting and promoting mental health in out-of-school time. To explore some of the current mental health needs of school-age children, their families, and the OST workforce. It discusses the social and emotional constructs that promote resilience, as well as examples of mental health supports that states and local jurisdictions can consider for collaborative implementation. Given evidence of trauma due to the recent global and national issues, communities have to consider all outlets and resources possible to address the needs of children and families. We know that out-of-school time programs foster socialization, relationships, and adaptive functioning, and that they are uniquely positioned to support and promote children's healthy development, inclusive of mental health needs instigated by trauma. And children are not the only recipients. Parents and the out-of-school time workforce can benefit from mental health supports provided directly or indirectly in these environments. And now I'm going to turn it over to my colleague, Suzanne.
Hello, everyone. Thanks, Katari. So there's strong consensus that the pandemic, the racial reckoning, the economic instability of the last year has placed increased importance on putting social, emotional, and mental health supports in place for everyone in the out-of-school time world. And providers, families, children have endured stress, health worries, and isolation. And that includes us too. I liked seeing that people are really looking at their own self-care because we're taking on a mantle of responsibility to help others. And so we're going to kind of unwrap a little bit what we have to do in order to do that for other people. And what we know is that the quality of children's relationships and experiences in out-of-school time shape their cognitive, behavioral, and emotional development. So we need to support the out-of-school time workforce's mental health so that they in turn can help children and families. So as system level providers and program implementers, it's our job to put on their oxygen masks first.
All right, my video is working now. We want to share that child trends indicated that prior to the pandemic, as many as 1 in 5 children had a diagnosed mental health disorder. And while we are not clear precisely how the pandemic has impacted children's mental health, the evidence shows a surge in, the preliminary evidence shows a surge in anxiety and depression. We know that there are systemic barriers to access, particularly among low income, poverty, and those that are geographically more remote, such as rural and tribal nations. This seems to be especially true for young people of color and LGBTQ youth. In addition, almost 1/2 of parents report experiencing high levels of stress, which inevitably impacts their children and puts children at higher risk. And then there were the surveys that were done of childcare workers that show they also have been experiencing high levels of stress, anxiety, and depression, given the economic uncertainties, worries about their health and their family's health, and increased demands in their jobs. Strategies to support mental health, similar to social and emotional learning, include cross-disciplinary, innovative technology, and flexibility. All 50 states did make some changes to their systems, and the hope is that some of these will remain. Suzanne?
So as we think about how to support social emotional development and its relationship to mental health, whether for staff, youth, or families, it can be helpful to think about it through these 3 tiers. So the universal supports are the ones that are helpful for everyone. So it could be for children integrating kernels of practice into the day, for instance, opening and closing rituals. It could be having the language vocabulary that you use during the after school day be the same as what the school day uses to talk about social emotional health. And then for staff, it could be building their literacy around what this looks like and how they can support it and implementing it in the program. The next level targets support to those who may need more. For example, you may want to bring in a mental health consultant to help you look at things that you could do for the program to change practice to help everybody, or for individual children. That person could also provide technical assistance and professional development to staff. And then lastly, the intensive tier is for really like a referral for individual or family counseling. Katari.
Thank you. So researchers in the article Promoting Nurturing Environments in After-School Settings share 4 features that we agree encourage positive mental health. These are minimization of toxic social and biological conditions, reinforcement of diverse pro-social behaviors, limiting opportunities and influences for problem behavior, and promoting psychological flexibility in the pursuit of one's values and goals. So we hope that this is bringing to mind some of the practices your state or program have in place to support youth's mental health. Suzanne?
Yeah, so what we have is more ways that we can support youth. And we're drawing on the Wallace Foundation's evidence-based considerations for COVID-19 reopening and recovery planning and our mental health brief, and are reminded again of the importance in creating a safe and engaging environment for youth to support their learning, their asset development, and to build relationships. In order to do this with consistency, all staff interacting with youth need to receive targeted guidance on and professional development on how to build a positive climate, as well as healthy adult-youth relationships, because both of these are natural mental health supports. And what we also know is that community partnerships at the state and the local level are really important, because no one agency or organization can do it all. So the more partnership work we can do, the more comprehensive slate of opportunities for the youth that are being served and the families that are being served are available.
Great. So that brings us to issues around those comprehensive services, those community supports that are needed. We found that families benefit from community supports and systems of care. Some of these are detailed on this slide. The needs range from childcare to, of course, mental health wellness, along with basic needs like housing, as you see here, food, via the Supplemental Nutrition Assistance Program, which is SNAP. And then there is the Temporary Assistance to Needy Families, TANF, which provides monetary assistance to families and also helps with education and workforce. To talk about, though, as we move along to really get into examples, to talk about the awesome work happening in Oklahoma to support children when it comes to their mental health wellness. I get to turn this over to Hillary Burkholder from the Oklahoma Department of Human Services, where, as said earlier, she is the Deputy Chief of Strategic Engagement. Welcome, Hillary.
Thank you so much, Katari. And I'm so excited to be able to share with such an amazing group of professionals today. So we're going to talk a little bit about Oklahoma's response to what was going on during the pandemic and the development of these community hope centers, and then how we are moving forward. So in April of 2020, we realized that we had received 710 fewer calls that month and year than we had the previous month and year. So 710 fewer calls from educators in April 2020 than in April of 2019, which makes sense because we knew that kids were not in the same systems that they are typically interacting with. But we also knew, and your slides show that too, that families were under a lot more stress. So we knew that while we were receiving fewer calls, that there were definitely families in need of help. And our Boys and Girls Club of Oklahoma County CEO called us and kind of confirmed what we were all thinking and said that they were starting to see children present with a lot more trauma than they typically do. And so we came up with a plan to go to the governor's office and ask for $15 million in CARES Act money so that we could provide a safe place for children that would provide wraparound services for them, and then also help support their families. So we turned to our established partners, those of you that are in the after school networks and doing out of school time support. We worked with Boys and Girls Clubs and YMCAs and urban leagues and Parks and Rec and a number of partners that were already seeing kids to provide wraparound support. We asked them to address food insecurity, so serve at least 2 meals and a snack daily, to provide social and emotional well-being activities that are focused on evidence-based curriculum, and to have an on-site mental health provider that could do exactly what you all were talking about with that integrated approach. So they provided reflective supervision. They identified when there were students, kids that needed more support and got them connected either through telehealth or in-person services. So they kind of did all of those pieces. And then we asked them to work on helping support remote schooling. And so everything from having the connectivity on site to the actual technology needed to participate, and then people that could help walk them through that and be an additional educational support. We had an embedded adult and family services worker from DHS there to work with families on those benefits that were mentioned previously, TANF and SNAP and medical and child care, to make sure that they were aware of all of the services and safety nets that were available, and that they got enrolled in those benefits, and that we could address any concerns that they might have. We also trained all of the employees for all of our community hope centers on the science of hope. Here in Oklahoma, we work closely with Dr. Hellman, who is kind of the primary researcher around the science of hope, and he's here at the University of Oklahoma. And so he trained all of the staff on that, which is really about identifying goals and pathways and helping families to maintain that willpower to achieve those. And so this allowed, all of this was set up to be reimbursable. They had the flexibility to really use the dollars however they needed and then get reimbursed. We brought in partners from CMHCs and other nonprofits to address the behavioral health component, and they were really able to work together and co-locate to offer a lot of services. And so we originally were focused on places where in-school was not an option because some districts in Oklahoma were still doing in-school. So we worked in communities that they could not go to school. Of course, they had very strict COVID guidelines they followed, and a lot of our partners ended up opening a lot more sites so that they could keep kids distanced and safe. And our goal originally was to have 30 around the entire state. We ended up with 52 of those that had the capacity to serve 3,000 kids. And that was just from August to December. So we were so impressed with what they were doing and how all of it was working. We started talking through a sustainability plan for spring semester, since we knew that we would not have our CARES dollars because we had only planned for those to go through December of 2020. So we got together with Seesaw, which in Oklahoma is the Children's State Advisory Workforce. And that group is made up of all the child serving agencies of our state. So we had the State Department of Education, OJA, our Office of Juvenile Affairs, Department of Mental Health, the State Department of Health, universities, a lot of different partners at the table to talk through what supports we could put in place. We developed a special childcare license, the Hope-Centered license, to help provide that funding sustainability. And we continued to have an embedded DHS worker that could be there for families. As we continue to think about what is needed in Oklahoma, we are working on kind of that future state. And so we will continue to have community hope centers. They may not all be in youth serving organizations, but they will all have kind of that component, and then broaden out the scope to really serve entire families. So we have been hard at work for creating a backbone organization that can help support so that nonprofits and organizations aren't having to take on too much administrative burden that would pull them away from their mission work. We also didn't want to grow it within government. There's often a stigma, especially with DHS. And so we wanted it to be community owned. So we're creating a backbone that can help support. We're exploring how to fund some of this with TANF dollars. TANF has some goals that are directly connected to keeping families together and helping support the economic independence and the well-being of those families. So moving forward, they will have to address physical health, behavioral health, basic needs, family and parenting, and educational and workforce supports. But it's designed to be community responsive, and really within those 5 components, the community can decide what types of services best fit their needs. And so our effort is really to change the distribution model of social services in our state by embedding workers, by having these community hope centers, by truly coming alongside these organizations and co-locating as a partner and not as kind of the owner of this. And so it is really our goal that families will engage with us and that we are able to continue to move upstream. So in the future, this may include things like drop-in childcare while or after school programming while parents can come and get some other services, and kind of just a wide variety of ways to partner. So we're really excited about what's going on here. It kind of aligns with our overall vision. We're also investing some TANF carryover dollars into community organizations to give them more capacity. So it all kind of works together for what we're doing here in Oklahoma. Thank you.
Thank you so much, Hillary, for sharing this excellent work and it's exciting to hear about how you've built on existing partnerships and also expanded and are really looking at a community-based model, as well as continuing the work, right? Because as Katari talked about earlier, as well as Suzanne, it's wonderful when some of these changes that were made due to COVID that are really supporting our children, families, and communities can be continued. I do have one question for you. I was wondering what the process was for families to get connected with these centers.
Sure. So largely they were families that were already engaging with those after school programs or closely in that community. So there were Hope Centers that were kind of created where there hadn't been those before. And we worked with them to help message, but largely outside of the brand of Community Hope Centers, which we created, we let them really kind of communicate with families from their own channels, because we knew that they had the trust built up in the community and that there's not always a lot of trust on the DHS side. So we tried to kind of support all of that, but really let it be done at a localized level. And so that was really our approach. And it really, I mean, we were lucky to have a lot of good momentum and good press around it. And so we would have families sometimes reach out to us, and we had on our website a map of where they all were so that they could identify those and we could direct people places. But I think because it was done with CARES funding and done through our governor's office, there was a lot of attention to them. And so it helped people be aware, and then we could help make those connections. One other thing that I had forgotten to say about the Community Hope Centers is that moving forward, we're really using that Family Resource Center framework. And so including kind of parent advisory committees and that whole process. So they will be really taking that and then the Science of Hope to build what they look like. So if anyone on here was familiar with the Family Resource Center model, that might be give some additional context.
Thanks so much. And now I'll pass it back to Katari.
Thank you so much, Hillary, for that insightful, compelling, and helpful information that really highlight the importance of collaboration to support all of the needs of children and families throughout the pandemic and beyond. Really like the focus on sustainability and that you had great flexibility around capacity, and your statement of making sure that this is community owned seems to really resonate with the needs and how programs feel about their community. So are there we have about 2 minutes or so for any questions, if anybody would like to put any questions in the chat. So just thinking about what are some strategies, or you can share what are some strategies that your program, municipality, and or jurisdiction are implementing to address mental health needs. So anything that you can share, similar to what Hillary has shared with us. And the question, thank you, Kate, has been placed in the chat for those of you who, as well as it's here on the screen. Alrighty. So I think what we can do, if there aren't any questions at that time, but if you do have questions that pop in your head, well, Michelle Keller shared that they are offering mental health first aid training. That is awesome. That is awesome. Where if there aren't any other responses at this time, feel free to throw those in the chat anytime during this, this webinar, during our time here. or you have any questions at any time. And I am going to turn this back over to Suzanne.
Thanks, Katari. Yeah, great. If people still want to keep adding their practice into the chat, I think it would be really valuable for everyone to see what other people are doing. That's the cross-pollination and the opportunity of these gatherings, these national webinars. So we're going to drill in a little bit more to the out-of-school time workforce and mental health. So this model is, this is a model where one side, everything is going fine. So there's satisfaction, no roadblocks. And then the other side shows the dangers and what can happen if somebody's struggling with compassion fatigue. So during regular time, pre-pandemic, many within our workforce worked many hours, or maybe didn't work a lot of hours, maybe didn't have benefits. A lot of our field does not have benefits, which are stressful elements within themselves. Then you add a pandemic, learning new ways of doing things and providing emotional supports to children and families, and you can start to experience compassion fatigue. It's a broadly defined concept that can include emotional, physical, and spiritual distress in those providing care to another. It's associated with caregiving, where people are experiencing significant emotional or physical pain and suffering. Secondary trauma is feeling the effects of supporting those who have had exposure to traumatic experiences, such as poverty or hunger. And then burnout is just exhaustion. Compassion fatigue can arise with prolonged exposure, which we have certainly had, to suffering that affects empathy and can affect job performance. Next slide, please. This slide shows, it compares the signs and symptoms of compassion fatigue and secondary traumatic stress and burnout. So one of the things that we see, research has shown that the symptoms of compassion fatigue can be anger and blaming and coming in late and not sleeping well and low self-esteem and just having a really hard time. So that then can lead to secondary traumatic stress and trauma. And these are all, and then burnout, and all of these are serious conditions. And we know that we need to support ourselves, our loved ones, and help bolster anyone in out of school time who is experiencing this, and supporting the mental health needs of our field. Katari.
Next slide, please. So this brings us to systems level planning and how we need to think simultaneously about how partners and funders can help us make advances in policies and systems, and how to make the best choices in supporting the out of school time workforce and programs. In this period of recovery, I would say we have access now to 3 stimulus packages: the recently passed American Rescue Plan, the CRRSA passed in December, and the CARES Act passed last spring. And then there are those stable things that have been there, like the Child and Adult Care Food Program, known as CACFP, are consistent funding sources. This is a key resource, CACFP, to address food insecurity. State agencies such as CCDF, lead agencies, and 21st Century, state after school networks, and city intermediaries, and those state and local education agencies are using policies and systems to support providers who in turn are helping youth with well-being and self-care. Very important to nurture the nurturer. Through mindfulness, learning, social emotional learning best practices, and engaging in continuous quality improvement. It's very important that I reiterate again here that strengthening the provider enables them to strengthen our youth. So, with no further ado, and on that note, I get the pleasure to turn this over to Ebony Grace of the New Jersey Statewide After School Network. Thanks, Ebony.
Thank you, Katari and NCASE, for inviting me to be a part of this important discussion today. Again, I'm Ebony Grayson, the Chief Operating Officer for NJSAC, we're the statewide after school network, as well as the state affiliate to the National After School Association. And I'm also on the board of directors of NAA. So at NJSAC, we provide training and technical assistance, professional development, quality coaching for school age, after school and out of school time youth care providers. As we shifted to the pandemic and beyond, we have implemented a number of additional resources to support social emotional health and social emotional learning and mental health for our providers. So one of the first things that we implemented was what we call after school conversations with NJSAC. We found that there was a need to increase our contact with our providers and our communication. And so what we did was we increased our monthly provider network meetings to weekly, where our providers can network, share challenges, and collaborate to resolve issues related to the pandemic. And we've pretty much been going weekly since the beginning of the pandemic, which my sense of time these days is quite off since the beginning, and we've had a steady attendance and participation in our after school conversations where our providers can just really talk to each other about issues and challenges that they've been experiencing and helping each other to try to resolve them, if not just to be able to share some of the challenges they've experienced. During those after school conversations calls, we've also invited guest speakers to enhance what we provide to the participants, such as, for an example, partners from the Montclair State University Center for Autism and Early Childhood Mental Health. And they focused on the impact of stress on the brain, recognizing signs of compassion fatigue, as was mentioned earlier, and then also strategies for self-care. So that was some of the things that we focused on throughout our after school conversations and continue to focus on weekly. The next change that we implemented were we found that there were content and topics that kept on popping up throughout our conversations, our weekly conversations. So one of the things that we did was implement work groups, topical work groups that were for a limited amount of time, because again, everyone was busy or is busy as they continue to operate throughout the pandemic and afterwards. And so what we did was implemented a number of work groups, one being health and safety for childcare programs that were still operating. One was the training group, but the one prevalent to this conversation is the SEL work group, social and emotional learning work group, which I happen to implement. That particular work group served two purposes: to share and discuss resources for supporting social emotional learning for participants and for staff as well. And we also created an SEL framework with curated resources and activities to provide for youth K through 12 and for the staff. So for the framework, particularly, we align that with CASEL's SEL competencies, which, if you don't know, there's self-awareness, self-management, social awareness, relationship skills, and responsible decision-making. And what the group did, the group was about probably 8 to 10 people regularly. What we did was share activities and resources that providers can implement very quickly, easily to support these different areas. And again, we did it for K through 12 youth, and in the framework, it's broken down by the younger grades, middle school, and then up to high school. And then we also included activities for adults. One of the things that's very important to me is to make sure that the information that we're the information and resources, the techniques that we're doing with our youth, that we make sure to model those with the adults and the providers that we're working with. So we made sure to include youth, adult examples as well. So one of those things I've always said, we implement mindfulness with our youth. Why not take those moments as staff to also practice mindfulness when we're when we're implementing the activities for the youth that we provide care for. The second purpose of that SEL work group was also an intentional space for providers to share challenges and concerns and help one another through networking and just plain listening and being heard. I was intent on making sure to hold part of the time for the directors and the staff that called in to process their feelings, whether professional or personal, as they experienced the pandemic. It was very important to me to make sure that we held that time, because I know as natural caretakers, we often don't take that time to access those feelings and emotions that we're dealing with on a regular basis, particularly throughout the pandemic when it was such a overwhelming and stressful time. And the last example I wanted to share with you all was we also have a technical assistance grant to work with the 21st century programs, 21st century community learning centers throughout New Jersey. And so we offered a session on self-care strategy session, excuse me. But I also failed to say is that I'm also a family therapist. And so I've taken some of the skills that I've learned as a family therapist to implement some of the sessions that we've provided. So again, we offered a session for our New Jersey's 21st century project directors, and we focused on understanding acute versus chronic stress and the impact of both on ourselves holistically, healthy and unhealthy coping mechanisms and strategies, and stress management techniques such as meditation or body awareness and breathing. So we provided a safe space for discussing the impact of the pandemic, and we plan on continuing to do that as we continue to go into recovery and into the fall and the new academic year. So I think that's about it. I think I'm on time.
Thank you so much, Ebony, for this wonderful information, the supports that you, that NJSAC, as how I say it, are providing for the OST workforce are amazing. So I am going to now turn this over. I get the opportunity to welcome Gina Warren of the National Afterschool Association so she can share some information about their tools to help the OST workforce.
Hi, everyone. Thank you, Katari, so much for inviting us and for including our professional guide to self-care in your brief. So it's such an honor to follow Ebony, as she mentioned, one of our National Board of Directors members and a leader in our state affiliate in New Jersey. And I'm so excited to see so many of our state affiliates on the call today. Thank you all for joining, and so good to be with all of you today. So the National After School Association, we are the professional member association for people who work in the out of school time, after school, school age field. At NAA, we believe that strong leaders lead strong teams who operate strong programs, who deliver high quality experiences and outcomes for young people. So we, we define strong as more than just, knowing, what to do and tied to different degrees. We define strong in this case as mentally strong, emotionally strong. And so we think of self-care strategies not only as wellness strategies, but as leadership strategies. So in creating our professional guide to self-care, we really wanted to focus on what individual program leaders could do to support their teams, who in turn would be able to support young people. So often I think in after school, we jump quickly, and Ebony noted this. We're in the caring profession. We jump right to what our young people need, what our kids need, sometimes what our families need. We don't think about what we need, and we don't think about what our teams need. So this guide was actually created with the adult professionals in mind. So we begin the practice guide really defining self-care. What is it? Why it matters? We outline the 6 elements of self-care. And then really importantly, with each of the 6 elements, we outline some practice strategies with each one. So what do those practice strategies look like? Well, one of the elements is around practicing self-care from a psychological standpoint. And we talk, what does a practice look like there? It looks like journaling. It looks like not answering work emails in the evenings, just really practical things, but often things that we don't allow ourselves to do or things that we really don't focus or prioritize on doing in our lives. One of the elements of self-care is professional self-care. So this is a chance for me to talk a little bit about how this relates to the work of NAA. We outline as a practice strategy is having a great support group. This fall, we offered some professional learning communities, and when we surveyed the members who participated, they were all very topically focused. What we heard from the people who participated was sure, the content was great. They learned a lot, but they mostly valued the chance to really connect with other people. And I think that's certainly something that Ebony was talking about that they're practicing in New Jersey. And I bet a number of you are as well. The fact that we couldn't be together in person over the past year plus meant that we had to turn to virtual connections. But what we found, and I bet a lot of you did, was that virtual connections did really provide great opportunities for professional connection, for those emotional attachments that we're looking for. So I hope that's something that we can all kind of take with us going forward. Another element of professional self-care is reading professional articles. And so that's something that we provide free every week in our NAA e-newsletter. So I encourage you to go to our site and sign up for that. We also have, I see it's on the screen here, our NAA After School Today magazine. Again, a free resource, great articles, great ideas there. And certainly participating in professional development opportunities is another element of self-care. We also in the guide outline the importance of your mindset, keeping a positive mindset. And again, something we talk to young people about all the time. How often do we make time to practice that ourselves and to really encourage our teams to do that? And then of course we have some additional resources at the end. So hope you all will visit our website. The link is again in the brief that NCASE has provided here. Check out the resources we have to offer. Check out this professional guide. And again, thank you all for giving me the chance to participate and share today.
Thank you so much, Gina, for sharing the wonderful work that the National After School Association is doing and continues to do to support providers and so that they can support youth and families. It's really wonderful to get to hear about that. And I'd also like to thank everybody who's been sharing in the chat about strategies that they've been using to support both staff as well as youth and families during this time. We've heard about some great training opportunities around social and emotional learning, mental health supports, and it's just really great to have this brain trust here and to hear from folks. As we wrap up, I'd like to let folks know or remind you, in case you're already aware, that the Child Care Stabilization Grants through the Office of Child Care American Rescue Plan Act funding may be used for mental health supports for children and employees. And there's a link to the information memorandum, and that information is on page 20. So we just have that quote there. And there's also an Office of Child Care COVID-19 resource site, which has a number of policy information, webinar recordings, and also will very shortly be including some technical assistance resources that can be used to communicate about stabilization grants. We'd really appreciate if you would take a few minutes at the end of this webinar, just a couple of minutes, to share with us your feedback on today's event. It really helps us to plan for future events, and we really honor and value your feedback. Before we jump into that, and I know Kate's going to put the link in the chat, I just wanted to make you aware that in this deck, we also have additional resources that weren't covered today, but might be of use to you. And the deck will be sent out after today's session, and we'll also let you know when the recording is available. We have our out of school time resource library, which includes over 400 resources relevant to out of school time. And then, as I said, we have a number of additional resources that may be useful to you in your work. So thanks for joining us today. I'm going to bring us back to the feedback slide, and we appreciate people taking time to give us some feedback. Thank you so much for taking the time to join us today, for sharing your perspectives, and a special thank you to our guest presenters for sharing some of the great work that you're doing, because we know that wonderful work has been going on and continues to go on around the country to support our children, our families, and our staff. Have a great rest of the day. Thank you.